Vitamin B12, also known as cobalamin, is one of the most essential vitamins that our body needs for its crucial functions. It plays an important role in the formation of red blood cells and the maintenance of a healthy nervous system and synthesis of DNA. Unfortunately, our bodies cannot produce vitamin B12 independently, means that we need to obtain it from an external source. Hey everyone, welcome back to your channel. I'm Dr. Mitra, and today I'm gonna explore the signs and symptoms of vitamin B12 deficiency. Join me in this video, and please first hit that subscribe button if you are not a subscriber, and then let's get started. But what are those sources of vitamin B12? Animal products are the main source. Meat, such as beef, pork, chicken, are rich in vitamin B12. Fish, especially salmon and trout, also contain so much vitamin B12. Additionally, eggs, dairy products like milk, cheese, and yogurt are also good sources. But fortified foods are the way that vegetarians or vegans get their vitamin B12. Some breakfast cereals, plant-based milk alternatives, and nutritional yeasts that are fortified with vitamin B12 make them suitable options for these individuals. But if someone lacks this essential vitamin, what symptoms or signs appear? The first one, neurological symptoms. Vitamin B12 deficiency can have significant impact on your nervous system, leading to various neurological signs or symptoms. You might experience tingling or numbness. This can be felt in feet, hands, or other extremities. Patients often describe it as pins and needles. Or someone might develop balance problems or difficulty in walking, because this deficiency also affects the spinal cord, leading to difficulties with balance and coordination. People might experience a wobbly gait or risk of falling. A person may experience memory impairment or cognitive issues. Then it would be difficult to concentrate, or maybe the person experiences mental fog. In order to have a quick recap of vitamin B12 deficiency signs and symptoms in neurological system, you can imagine this scenario. Sarah, a 45-year-old woman, coming to the clinic, experiencing tingling and numbness in her hands, accompanied by frequent stumbling while walking. She also noticed that she has been forgetful, and she also found it difficult to concentrate at work. Seeking medical advice, she found out that she was suffering from vitamin B12 deficiency. The second symptom, hematological symptoms. As I said, vitamin B12 is very crucial for making red blood cells. So if we are deficient in vitamin B12, we can imagine that we probably suffer from anemia, but it's a special kind of anemia called megaloblastic anemia, in which red blood cells become larger than normal. And first of all, what brings about anemia? Fatigue and weakness, because reduced red blood cells lead to reduced delivery of oxygen to the body's tissues, and you might feel weak and tired even after minor physical activity. Sometimes anemia can be diagnosed from person's appearance, because fewer red blood cells leads to a paler skin. So pale skin is another sign. And in severe cases of anemia, a person might experience palpitation and shortness of breath, because then the anemia gets more severe. The heart works harder in order to compensate for the number of red blood cells, and we notice this overworking through palpitation and shortness of breath. To have a quick recap, imagine John, a 30-year-old guy, coming to the clinic and complaining about fatigue, weakness, and palpitation. Doctor notices the pale skin, and the blood tests reveal megaloblastic anemia due to vitamin B12 deficiency. Imagine John also has a problem climbing the stairs. Of course, this can also make us suspicious about heart problems, but as the person was younger or the skin was pale, so it's made us more suspicious about maybe a more basic problem like anemia. That's why experiencing any of these signs and symptoms need a professional advice from a medical care provider. Vitamin B12 deficiency can also lead to gastrointestinal symptoms. This vitamin is absorbed in the small intestine, and certain conditions affecting the gut can lead to deficiency, resulting in gastrointestinal symptoms. People might experience reduced appetite and unintended weight loss. I mean that they are not on a diet due to an imbalance in digestive process. If someone is deficient in vitamin B12, they can have other digestive system signs or symptoms. They can experience bloating, diarrhea, or even constipation. Imagine Emma, a 50-year-old woman, visiting her doctor and complaining about decreased appetite and weight loss. She's also experiencing irregular bowel movements with and sometimes diarrhea. In this scenario, other problems or diseases come into mind, but with a simple blood test, it can be revealed that this person is suffering from deficiency in vitamin B12. And glossitis or red tongue can be another sign of vitamin B12 deficiency. But why this occurs? Because this vitamin's deficiency can lead to changes in papillae, which are tiny bumps on tongue's surface, responsible for taste perception. And as a result, the papilla might become swollen, leading to a smooth and glossy appearance of the tongue. Or even someone might experience mouth ulcers or cold canker sores. As this vitamin is responsible for maintenance of the mucus, the deficiency can weaken the mucous membranes, making them more susceptible to irritation and injury. Important to note that these oral symptoms are not specific to vitamin B12 deficiency, and they can also be seen in other conditions as well. And finally, thanks for watching this video. Hope it has been useful for you. Please don't forget to like, comment, and subscribe my channel for more videos like this. Stay healthy and see you next time.